Good afternoon, everyone. I'm Dr. Parinaaz Parhar. I'm the Clinical Head and Fertility Specialist at Oasis Fertility Secunderabad. Today, I'm going to be talking to you about how to optimize your fertility. Now, optimization of your fertility basically deals with what all can be done by you as a patient in order to maximize your chance of getting pregnant. This will not only help in increasing your success rate of your treatment, but also help you have a healthy pregnancy in the future, which will benefit both you and your child. So, as is quite understandable, optimization of your fertility to a large extent depends on improving your lifestyle choices in order to make the best out of current situation in order to increase your fertility rate, as well as adapting the right practices in order to increase the success rate. Now, to start with, what is your chance of conceiving at this particular point? Your chance of conceiving at any given time depends largely on the age of the female partner, as well as the number of months or years that you have been trying since. Your maximum chance of fertility is in the early 20s and 30s for ladies, and within the first 3 to 6 months of trying for a couple as such. When you start trying for a conception, your success rate can be as high as 30%. But mind you, in spite of everything being right and everything falling in place, the chance of conceiving in any given cycle is not more than 25 to 30%. So let's not have very unrealistic expectations that, oh my God, if everything is fine, why aren't we still conceiving? As you try, your chance of conceiving can be almost as close to about 80% in the first year of having regular unprotected intercourse. So that means that out of 100 couples who have been trying, about 80 of them will conceive within the first year of trying if everything is fine. Another 10% would conceive in the following year, which means that about 90% of those who are fit and fine would go on to conceive within 2 years of their marriage. Then when do you really need to get worried and try and seek expert help? So if you are someone who's less than 35 years old, and you have been having regular unprotected intercourse without the use of a contraceptive for the past 1 year and still have been unsuccessful, you need to get evaluated. On the other hand, if you're someone where the female partner is more than 35 years old, then this time period is reduced to less than 6 months. So if you have been trying since the past 6 months without much success, it's time to seek expert help. Why have we reduced this time to 6 months when the female partner's age is more than 35 years? Because age is very harsh to the female partner and her ovarian reserve. As we age, the number and the quality of our eggs keeps on reducing. As a result, the chance of success, the success rate with any sort of fertility treatment keeps on dropping. So that's the reason why we need to seek help earlier in this particular group of patients. Now, we can't do anything about the age as such, but then what are the things that we can really try and do as a couple in order to maximize your chance of fertility? So what we can all try to do is make some certain changes in our lifestyle, which we can easily follow and which will make us healthier and take us closer towards our goal. So first and foremost, a very common question which is asked by all our patients is that, is there something that we need to do about our diet in order to improve our chance of fertility? Well, that is something which will really go a long way. What you really need to take care of is that you should be including foods which are rich in folate, which are rich in vitamin E, D, as well as high in omega-3 fatty acids. Is there any particular type of diet, like there was a lot of talk about Mediterranean diet rich in avocados and everything, all these very fancy diets and items, very expensive food stuff. Do we really need to use all this in order to increase our chance of success? I wouldn't say so. As long as your weight is in the BMI range, when I say BMI, it means body mass index, which is actually it's a calculation which involves dividing your weight by your height in meters square. So if you do this calculation and if your body mass index falls in the range of say between 19 to 25, your weight is correct for your height and you fall in the normal range. If your body mass index is less than 19 or if it's more than 25, you are either underweight or you're overweight. Both these are undesirable conditions for your fertility. Why is that? Because if your weight is too less and if your weight is too high, in either ways, there is a tendency for hormonal imbalance, which leads to an ovulation, which means that your egg will not release spontaneously. Now, if the egg is not being released spontaneously every month, how is it possible to conceive? So it's very basic logic here. So if you are someone who has a weight between the range of 19 to 25 BMI, you don't really need to follow any extra fancy diet or anything. Just try to maintain your weight in the normal range. See that you have food which is not processed. Try and have a clean diet. Try and reduce the amount of sugar consumption in your daily diet. Cut down on coffee. Stop drinking alcohol. Stop smoking altogether, because these are things which are proven to have very adverse effects on your chances of conception. I'll come to each one of them. So the crux of the matter is, if you're in the healthy weight range, please, 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 there's nothing, you don't need to get paranoid about having this, having that. You can try and have a healthy diet, which is clean food, which is try and having more of omega-3 fatty acids, folic acids, and folate, and vitamin D3 and E-rich food. What is the food which is rich in all this? Your regular green vegetables, green leafy vegetables, your fruits, your nuts. Fish is very good. So all these things are the ones which are good for you if you're trying to get pregnant. Does the fancy food like avocado or does broccoli and all this, are they really going to increase your success rate further? Not really. If you are getting the required nutrients from your daily food, you don't need to go out of the way and purchase something like this to improve your chance further. If you feel that you might not be able to meet your daily needs by taking in your food, then you can take supplements. So as it is, anyone who is trying to conceive is advised to take about 4 up to 4 milligrams of folic acid for 3 months prior to they start trying for conception. So that's something which we as gynecologists regularly prescribe to our patients. It's not a bad idea to start with your vitamin D3 supplements, because it is something which is very rampantly deficient in all of us, and a D3 deficiency is something which has been associated with both poor egg maturity as well as poor sperm quality. So these two you can definitely include. If you're someone who has non-veg, have a lot of fish in your diet, that's good for you. If you're someone who doesn't have non-veg, you can still have your regular food and go for some omega-3 fatty acid supplements. Now, that was about what you can include in your diet. What are the things which you should cut down on? If you're trying for pregnancy, please stay away from both alcohol as well as smoking. And this is more important for the female partner to refrain from these two vices. Why is it so? Because smoking, as far as the male partner is concerned, smoking is going to affect both your sperm count and the sperm motility. And smoking has even been associated with abnormally shaped sperms. As far as the female is concerned, the effects are much more adverse. What it tends to do is it affects the functionality of your tubes, increasing your risk of ectopic pregnancy. It decreases your fertility as much as 40%. And it increases your risk of developing premature ovarian insufficiency. That means you might deplete your egg reserve and attain menopause much earlier than what you would have otherwise attained. So since diminished ovarian reserve is on the rise now, since we're seeing a lot of patients with low ovarian reserve very early in life, one lifestyle tip which you can definitely look forward to is please stay away from smoking. Alcohol is not as bad for men, but yes, it is something which, if taken in huge amounts, will definitely affect your hormones and affect the production of sperms. For females, if you're planning a pregnancy, please do stay away from alcohol, because it has been associated with a number of deformities in the baby. So a big no for having alcohol in ladies. Coming to your coffee consumption, a lot of patients, with our current lifestyles, we want to be at the top of the game all the time. So we're just keeping on gulping down coffee one after the other. But coffee is also known to be bad for your fertility. So how much is too much? So what they tend to say is that something around 4 cups of instant coffee or 3 cups of regular coffee is something which you should be limiting to. So basically, you should try and limit yourself to roughly not more than 2 cups of coffee per day. Tea, on the other hand, is also bad. So with tea, it should be about not more than 3 cups per day. So these are the things which you should try and stay away from, both as whether you're the male partner or the female partner. Now, the other thing which you should be really looking at doing in your daily lifestyle is include some amount of exercise. Exercise, yoga, meditation, irrespective of your body mass index, in general is good for all patients, anyone who's trying for fertility. It's an excellent lifestyle modification for anyone who's trying to conceive because it will help you continue this habit into your pregnancy, and exercise in pregnancy is something which you should really be encouraged because of its benefits. Now, what kind of exercise are we looking at? If I'm saying exercise, please don't go overboard with it. Too much, if anything, is not good. So when we are looking at exercise, ideally you should be doing about 30 minutes of moderate intensity exercise for about 3 to 4 times a week. That should be enough. There's no need of going overboard with anything. Moderation is the key. The reason why I'm saying that is because if you exercise too much also, that in turn is a stress for the body. And that in turn will lead to anovulation and the egg not being released. So that's another reason why we are saying that the exercise should be in moderation. Now, the other thing which we have to keep in mind is that exercise, even if you're someone who's lean, you would say, why do I need exercise? Because infertility is a stressful realization, I would say. If you're a patient who's undergoing fertility treatment, if you include some sort of meditation and some sort of exercise in your daily routine, besides regularizing your weight and helping keeping it in check, it also leads to the release of the feel-good factors, which are called as endorphins in the body, which will uplift your mood and which will which will release a lot of positive vibes and will which will improve your response to whatever treatment and your attitude towards whatever treatment you're undergoing. So definitely exercise deserves a big thumbs up. Now, this was about what all you can do in your daily life in order to improve your chances of conception. What are the lifestyle factors? Now, coming to the main act, how to go about it, what you should be doing, when you should be doing. So now, there is a concept which is known as the fertile window. What is the fertile window? Fertile window is basically, it is the time of the month when the chances of someone conceiving, of the egg meeting the sperm, is maximum. Now, how do we calculate this fertile window? Now, before that, the first question which comes to our mind is that, is 28 days of cycle normal? Is normal only equal to having a menstrual cycle of 28 days? If someone has 29 days, 30 days, 32 days, is that abnormal? The answer is no. So if you're someone who has a cycle duration between 21 to 35, it can be considered as normal. So that is 28 days plus minus 7 days is fine. That might be normal for you. Then how do you calculate the fertile period? A lot of patients are under the misconception that, fertile period means lady is going to ovulate on day 14. Well, that holds true for someone where the cycle duration is 28 days. If you're someone who's having her periods every 35 days, your ovulation is happening around day 21. So that is the time when you should be really looking at trying to get pregnant. So how do you calculate the fertile window? How do you calculate when you're ovulating? So the first thing is you maintain a menstrual calendar. You have a lot of apps which are available nowadays. You can keep a track of when your period is starting. So the day your period starts, the day the bleeding starts is day 1 of your cycle, and then monitor till when it starts again. So if suppose you are getting your periods every 30 days, you have monitored for the next 4-5 months and you have arrived at the conclusion that you normally bleed every 30 days. Well, in that case, your ovulation would be happening around 14 days before that, that is around day 16. So approximately, if you're someone who is regularly having periods every 30 days, your ovulation should be happening on day 16. Now, once the egg is released, it is alive only for 24 hours. But if you have had intercourse, the sperm can be alive in the female reproductive system for up to 5 days. Therefore, based on these simple facts, the fertile window is calculated as 6 days prior to the expected date of ovulation. And this is the time when you have maximum chance of conceiving. So, if you have monitored that what is the average duration of your cycles, you take about 14 days, you minus 14 days from then, that is the approximate date of ovulation, and you should start trying approximately 6 days before and a day after that. So this is that 1 week in the whole week where you have maximum chance of conceiving. But then how often should you try? Does it mean that you should try about 3-4 times the same day or every day? And if you miss that day, oh my God, there's no chance of getting pregnant that month? No. That's again where the science comes into picture. Like I said before, the sperm is going to be alive in the female reproductive tract post intercourse for up to about 5 days. So daily intercourse, that too when you're like, no, we can't miss the days, it can be very mentally and physically taxing. So rather than going all paranoid about the date, what you can do is that you can try and aim for at least alternate day intercourse during this time period of the fertile window. So that's the time you can, if you're not able to manage, okay, if you can manage every day, well and good. But if you cannot manage every day, alternate day should also be fine. And please, like I said before, even if everything is right, there is a chance of 25% of conception in a particular month. So don't be heartbroken if it doesn't work out a particular month. Give yourself time. If you're less than 35 years, give yourself a year's time before getting all alarmed, unless there is some very obvious problem, which even you as a layman has realized about yourself. And if you're more than 35 years old and if you're following this and still have been unsuccessful in conceiving, then you need to seek help from us after 6 months of trying. So I have spoken about the fertile window. I've spoken about the frequency of intercourse to say. The next question which crops up very frequently is that how do I come to know that I'm ovulating or not, whether I'm really ovulating on day 14, day 16 or not? So there are physiological changes which occur in the body. A couple of days before your ovulation, that's about 3 to 4 days prior, because of the hormonal changes which are happening, there will be a change in the cervical mucus, which you realize as vaginal discharge. So if you are someone who's having regular periods, you will notice that there is a lot of slippery, increased mucosal discharge which occurs a couple of around day 10 to 14 of your cycle. That's nothing but it's another one of the signs of you ovulating. So it should also give you a hint that, okay, this is the time when I should really be targeting and keeping relation in order to increase my chances of conception. This is your body telling you that you're going to be ovulating soon. Once you ovulate, there is a very obvious change in the consistency of this mucosa. So just before ovulation, the cervical mucus tends to become very slippery, almost like an egg white. That's one thing. The second thing which a lot of people talk about is the basal body temperature. That, immediately after ovulation, you start feeling as if your temperature has risen a bit because of the progesterone hormone. But then this is not very helpful for you because this happens post-ovulation. We want to know when you're ovulating beforehand. So, but anyways, that's one of the signs that you do ovulate regularly. The third thing which a lot of people are aware of and using nowadays are the ovulation kits. So you have these LH search kits which are easily available over the counter in the market. And what you can do is that you can take your early morning urine sample before you drink any fluids. And you can use these kits to see whether there has been an LH search. So if there's been an LH search, there will usually be 2 lines on the kit. And that usually means that you will be ovulating in the next 2 days. So once you detect a surge, you should try and keep relation for the next 3 days from then, because then your chances of conceiving are at a maximum. So that's about how you monitor your ovulation. Now, a lot of times patients have questions like, is there any particular position which is going to help in increasing my chance? Or a very commonly asked question is that, we do keep relation, but it all just leaks out. Now, firstly, there is no particular position which is going to increase your chance of conception. The human body is designed in a way that you really don't need to go extra mile and to increase your chance of conception. There is no point in putting your legs up and lying down for about 15-20 minutes. It doesn't work that way. If everything is right, you don't need to do these extra things. They're not really going to improve your chances. The other thing coming to about whether if the semen is leaking out of the of the vagina post intercourse, does it mean something is wrong? No, it's not. Usually the semen volume is about anywhere between 1.5 to 3 ml, whereas your uterine capacity is only about 0.5 ml. So there is bound to be some amount of backflow and some amount of leakage. It is normal. It doesn't mean that something is wrong with you. That was about the coital practices. A lot of people tend to use lubricants in order to improve, to reduce any pain or to make it a bit more easy for them to perform the act. Does it really improve or decrease your chances of conception? Lubricants, especially the commonly used KY jellies and all which are available over the counter, tend to contain certain spermicidal agents which might be harmful to the sperm. So if you're someone who's trying to conceive, it would be advisable that you don't use any sort of lubricant. If you really are in the need of using a lubricant, use something which has a hydroxycellulose base, mineral oil, canola oil. All these are okay. You can use these. But the other jellies and all which are normally used are containing some agents, chemical agents, which can be harmful to the sperm and in fact decrease your chance of conception. So that is not advisable if you're planning to conceive. So this is about what you can do in order to improve your chances of pregnancy of conception. Now, like I said in the beginning, if you have been doing everything right, as I have tried to reiterate in this particular video, but it's been over a year despite your sincere efforts, if you're less than 35 and more than 6 months if you're more than 35 years old, you need to seek expert help. You need to get evaluated to find out what is wrong, what needs to be done in order to improve your chances further. Also, if you're someone who's had some sort of abdominal pelvic surgery in the past, as far as females are concerned, if you're a male, or if you're a male who has had some sort of testicular injury or some surgery involving that period, or some hernia operation done in the past, or if you're someone who's had some cancer radiation received in the past, well, in case of all these cases also, it would be advisable that you seek medical help earlier. If you're a female who is not having regular periods, who's having irregular periods, you don't need to wait for 1 year before trying to, seek medical help. In this particular case, you would need to try and consult a doctor earlier, because in such patients, ovulation is not predictable, or it might not be happening at all. So the moment you realize that you're ready to start a family, please meet a doctor, understand what is the reason for your irregular periods, and see how far it can be corrected before you can try and conceive. That was all about this topic. Let me know if you have any more questions about this. You can put it in the chat box and I'll see whatever I can answer. And if you don't have any questions as of now, you can post it up on our website and we'll get back to you as soon as we see them. Okay, I see a question. How can I improve my AMH and egg quality? Okay, how can I improve my AMH and egg quality? Hi, Haripriya. So there is no miracle drug which is really going to just improve your AMH overnight. There are some medicines like your DHEAS and a lot of marketed medicines out there which say that they will really help improve the AMH, but trust me, there's nothing which is really going to double your amount. If you're someone who is known to have a low AMH, well, in that case, one thing which you can do is that understand that as time goes, this quantity is going to go down further. First of all, for those who don't understand, AMH is a test. It's your anti-Mullerian hormone. It is a marker of your ovarian reserve. It is a test which tells me, it's a blood test which tells me how many eggs do I have remaining. It gives a rough idea about that. It does not tell me whether I can get pregnant or not. It does not tell me about my egg quality. It just tells me that whether I have an egg reserve which is in the normal range, which is more than normal, or which is less than normal. So that's one thing. If you are someone who has low AMH, you need to be aware of the fact that with time this is going to go down. So please talk to your fertility expert and be a bit more aggressive in your treatment to try and get pregnant as soon as possible, because that's your best bet. As far as trying to improve your AMH is concerned, there are some supplements which are available which might make a difference of about 2 or 3 eggs, but not more than that. The other thing, coming to your question about how can you improve your egg quality, well, egg quality, if you're someone, like I told you, there are some things which you can try and do. If you're someone who is on the heavier side, or if you're someone who's suffering from PCOS, obesity and insulin resistance, both of them are associated with poor egg quality. So someone who is on the heavier side will definitely benefit from trying to exercise and doing some dietary modifications to try and reduce their weight, which in turn will reflect on their egg quality. That's one thing. The second thing is the egg quality. You can also take some supplements like I was talking about. You can try and include food which is rich in, or if you cannot include the food specific for it, you can try and take supplements for vitamin E, omega-3 fatty acids, and vitamin D3, because these have been associated with egg quality. If you are someone who had an IVF cycle where the doctor pointed out that the egg quality was very poor, it can be your response to the stimulation drugs. So maybe you might benefit from taking a change, having a change in the protocol or in the medications which were offered to you. So these are some things which you can do and try to improve your egg quality. I hope I've answered your question. Anything else? Can folic acid improve the egg quality? Yes, but not remarkably. Folic acid, the main purpose of giving folic acid is mainly because a deficiency of folic acid is associated with neural tube defects in the baby. So what do you mean by that in layman term is that if you have insufficient folic acid in your diet for 3 months prior to pregnancy and for the first 3 months of pregnancy, then you can develop, the baby can develop defects in the central nervous system. So these are the babies where they have defects in the spine, they have anencephaly where the brain box is not there, or their tube, the spine is exposed. They have different types of meningomyelocele and all these defects. So it's one of the problems which has been associated with a nutrient deficiency, and that's why they say that you should supplement folic acid to try and avoid this during the periconception period. I think that's about it. What are the warning signs of infertility? So someone else has asked us, what are the warning signs of infertility? Well, infertility is a diagnosis which, like I have told you, is reached upon when you fail to conceive within 1 year of having unprotected regular intercourse. That means you've not been using any sort of contraception. You are having intercourse at least about 3 times a week, and still you're not able to conceive. So the warning signs, so if it's been more than 1 year since this, you need to get evaluated to find out what is wrong, because about 84% of healthy couples would have conceived by now. So that's one warning sign of infertility. The second thing is if you are someone who has irregular periods, because irregular periods is a marker for anovulation, which means that you are probably not ovulating at all. And if there is no ovulation, which means the egg coming out of the ovary, if that basic function is not happening, how are you going to conceive? So that's one thing. The third thing is if there is a difficulty in having intercourse. So if there is some sort of erectile dysfunction in men, or there is some ejaculatory dysfunction, or if the female partner is experiencing a lot of pain and not allowing penetration, which is known as dyspareunia and even vaginismus, in these cases, obviously the couple will have infertility and they need expert help in order to diagnose what's wrong. Also, if you're someone who's had some sort of cancer treatment in the past, you might be suffering from either lack of sperms, or you might be having very low reserves. So then again, you need to seek treatment. If you have a family history where your mother or your sister attained menopause very soon, these are again reasons where you should be you might be having low reserve, and you should seek expert advice. Also, because we're seeing a lot of cases of patients where they are being diagnosed with very low reserve very early on in life. So if you're someone who has recently noticed a sudden change, or you have noticed a change in the duration of your menstrual cycle, where it has shortened in the duration, where suppose earlier you were having periods every 30 days, but now you've noticed you're getting it more frequently every 24, 20 days. That could be a sign of low reserve. And so these patients also need to take medical help. If you're someone who's been operated for endometriosis, or who's had some TB in the past, or if you're someone who has had any sort of pelvic surgery in the past as a female, you might be suffering from adhesions. And again, these are the patients who might need evaluation earlier. So there's a question about when you are undergoing an IUI, whether you should be really having intercourse around that time, or whether you should be practicing abstinence. If I'm getting the question right, that's what has been asked. So here it's important to understand that the quality, if you're someone who has a good semen count. And if you're undergoing an IUI for unexplained infertility, or if it's a case, if it's unexplained infertility or it's just mild male factor infertility, in these cases, having regular intercourse tends to improve your sperm quality. It tends to improve the motility of the sperm, and it tends to reduce the DNA fragmentation index. So we do encourage our patients, if they're going for IUI, to still have alternate daytime intercourse. One of the reasons being that besides improving the sperm quality, it also tends to improve the chances that they would have intercourse and there would be semen present, sperms present in the reproductive tract around the time of the ovulation, increasing the chances of the patient conceiving. So a lot of times patients will be like, no, we are undergoing IUI procedure. We have been abstaining since the past 1 week, 1 week or 10 days. We have not had, the husband would say, I've not wasted a single sample because I want to give maximum good quality sperms on that particular day. No, that's a wrong concept, because the longer the duration of abstinence, the poorer will be the quality of the sperms. So don't be under this misconception that if you have longer duration of abstinence, you will give very good quality sperms. No, it's in fact the contrary. The more the frequent ejaculation is there, the better will be the quality of sperms. So it doesn't harm if you have had, if you're undergoing an IUI and if you had intercourse just 24 hours prior. On the other hand, if you're someone who has very poor quality sperms, in such cases, what can be done is that, or you're someone who has fluctuating semen parameters, in such patients, we usually, just to safeguard against this particular problem where the husband might not be able to give a good volume or a good count the next day, it's usually advisable that they have one backup semen sample frozen. I think I've answered all questions. Okay, very interesting question. What are 3 ways to prevent infertility? Okay, 3 ways to prevent infertility. First and foremost, it's be aware of your situation. Okay, so the best way to prevent infertility is to be aware and to be well informed about what is infertility. The second thing is to have a healthy lifestyle, like I have already discussed, to eat right, to be in the normal weight range, and to try and have regular intercourse. Now, I would not really promote the use of NH kits and all in order to try and target the fertile window and be very regular about that, because that itself is a type of stress, and stress is not very good for your fertility. So rather than that, even if you try and have intercourse about 3 to 4 times roughly in a week, that should be enough. That should do the trick. So there's no need of going paranoid. So if I was to summarize about what are the 3 ways to prevent infertility, first of all, be aware of your situation. Just see if you have any of those red flags, and if you have any of the red flags which we have already discussed, seek a consultation with a fertility expert. The second thing is don't delay too much. I know we are all very conscious of our careers and we want to be overachievers, and there is absolutely nothing wrong with it. We have our life and we should do the best of our potential, but at the same time be aware of the biological clock. And if you don't have time for a baby right now, but if you would like to have one in the future, be aware. You can seek a consultation to know more about fertility preservation, because that is something which is really helping you eat the cake and have the cake and eat it too. So fertility preservation is a great way out for such people. So 3 ways to prevent infertility is basically to be aware of what all are the options available specifically for you, to know when to seek medical treatment, when you need to seek consultation with an expert. And the third thing is to adopt healthy lifestyles, where practices like have a healthy weight range, practice a bit of meditation, do moderate exercise, eat healthy, stay away from smoking alcohol, and have regular intercourse. So if you follow these, and if things are fine, I don't see any problem why you should have difficulty in conceiving. And if you still are having difficulty in conceiving, we are there to help you. Any other questions? I think that's all for today. So feel free to, if you still have some questions which are unanswered, please feel free to ask us and we'll be happy to get back to you. Thank you.